You look at your nails every single day, but you've never been taught to read them. Your fingernails aren't just dead keratin growing out of your fingers. They're a diagnostic window into your circulatory system, your oxygen levels, your nutritional status, and even hidden diseases that haven't shown symptoms yet. Doctors have used nail analysis for centuries because nails don't lie. They grow slowly, methodically, recording everything happening inside your body like rings in a tree trunk. Today, we're going to decode what your nail shape is actually telling you about your health. Some of these signs are harmless genetic quirks. Others are urgent warnings that demand immediate medical attention. Let's start with the anatomy so you understand what you're looking at. The nail architecture. Your nail isn't just one piece. It's a complex structure with multiple layers, each revealing different information. The nail plate is the hard surface you see. Underneath is the nail bed, packed with blood vessels. At the base, hidden under your skin, is the nail matrix. This is the factory where your nail cells are born. If something damages the matrix, you'll see it reflected in the nail plate weeks later as it grows out. Fingernails grow about 3 millimeters per month. That means the nail you see today is a snapshot of your health from 2 to 6 months ago. This is why sudden illnesses create visible horizontal lines. The trauma gets recorded in real time. Now let's break down the shapes and what they mean. Shape 1. Normal, smooth, slightly curved. This is your baseline. A healthy nail has a gentle dome shape, curving slightly from the cuticle to the tip and from side to side. The surface is smooth without ridges, pits, or discoloration. The nail bed underneath shows a healthy pink color, indicating good blood flow and oxygenation. If you press on the nail and release, the pink color should return within 2 seconds. This is called capillary refill time. It measures circulation. If your nails look like this, congratulations. Your body is getting adequate nutrition, oxygen, and hydration. But if your nails deviate from this template, your body is signaling something. Shape 2. Spoon nails, koilonychia. Imagine pressing your thumb into soft clay. The center sinks while the edges rise. That's koilonychia. The nail becomes so thin and soft that it curves inward, creating a concave depression. In severe cases, the nail can actually hold a drop of water. This isn't cosmetic. This is a red flag for iron deficiency anemia. Here's the mechanism. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen. When iron drops, your body rations it. It prioritizes your vital organs, heart, brain, lungs, and pulls resources away from non-essential structures like nails. Without adequate oxygen and nutrients, the nail matrix produces weak, malformed keratin. The nail plate thins and loses structural integrity. Koilonychia can also appear in people with hemochromatosis, a genetic condition causing iron overload, or in those with autoimmune disorders like lupus. If you see spoon nails, get a complete blood count and iron panel immediately. This is fixable, but untreated anemia can cause organ damage. Shape 3. Clubbed nails. Clubbing is one of the most serious nail changes. The fingertip swells and the nail curves downward over the enlarged tip, resembling the back of a spoon or a drumstick. To test for clubbing, place your 2 index fingers back to back, nail to nail. Normally, you'll see a small diamond-shaped gap at the base where light shines through. In clubbing, this gap disappears. The nails meet flush. What causes this? Chronic low oxygen levels. Clubbing develops when your tissues aren't getting enough oxygen over months or years. The most common causes are lung disease, chronic obstructive pulmonary disease, lung cancer, pulmonary fibrosis, and congenital heart defects that allow deoxygenated blood to bypass the lungs. Clubbing can also occur in inflammatory bowel disease, liver cirrhosis, and hyperthyroidism. The mechanism isn't fully understood, but researchers believe chronic hypoxia triggers the release of growth factors that cause the soft tissue under the nail to proliferate. If you notice clubbing, this is not something you wait on. You need imaging and pulmonary function tests immediately. Shape 4. Bowes lines, horizontal ridges. Run your finger across your nail. If you feel deep horizontal grooves cutting across the nail plate, those are Bowes lines. These aren't surface scratches. They're depressions that form when the nail matrix temporarily stops producing cells. Think of the matrix as an assembly line. If the factory shuts down for a week due to a crisis, that gap gets recorded in the product. When the factory restarts, you see a ridge. Beau's lines are caused by acute stress events, severe illness, high fever, chemotherapy, malnutrition, or major surgery. The timing of the line tells you when the event occurred. Measure the distance from the cuticle to the ridge and divide by 3 millimeters per month. A ridge 6 millimeters from the base means the trauma happened 2 months ago. Beau's lines eventually grow out as the nail replaces itself. But if you see multiple lines forming repeatedly, that indicates recurring illness or chronic malnutrition. Shape 5. Vertical ridges. Unlike horizontal Beau's lines, vertical ridges running from cuticle to tip are usually benign. They're like wrinkles for your nails. As you age, the nail matrix produces keratin less uniformly, creating subtle grooves. Most people develop these after age 40. They're cosmetic, not pathological. However, if vertical ridges appear suddenly or become pronounced in younger people, it can indicate dehydration, nutrient deficiency, particularly B vitamins and zinc, or thyroid dysfunction. Severe vertical ridging with a sandpaper texture can also be a sign of lichen planus, an autoimmune condition. The key distinction is severity. Light ridges are normal. Deep, jagged ridges warrant investigation. Shape 6. Pitting. Imagine taking a pin and making tiny random dents across the nail surface. That's pitting. It looks like the nail has been attacked by a miniature ice pick. Pitting occurs when cells in the nail matrix are damaged in small, localized patches. The most common cause is psoriasis, affecting up to 50% of people with the skin condition. Psoriasis is an autoimmune disorder where the immune system attacks skin cells, causing rapid turnover. When it affects the nail matrix, you get pitting. Pitting can also occur in alopecia areata, another autoimmune condition causing hair loss, and in reactive arthritis. If you have pitting plus joint pain or skin lesions, see a rheumatologist. Early treatment can prevent permanent nail damage. Shape 7. Onycholysis, nail separation. This is when the nail plate lifts away from the nail bed, starting at the tip and progressing backward. The separated area turns white or yellowish because there's air underneath instead of tissue. Common causes include trauma from repetitive impact like typing or playing guitar, fungal infections, psoriasis, thyroid disease, and reactions to nail products or medications like tetracycline antibiotics. The danger here is infection. Once the seal breaks, bacteria and fungi can colonize the gap. If you see separation, keep the area dry, trim the lifted portion, and avoid further trauma. If it doesn't improve or spreads, get it cultured to rule out infection. Shape 8. Yellow nails. A yellowish tint can have multiple causes. The most benign is staining from nail polish or smoking. Nicotine stains nails a distinctive yellow-brown. But if all 10 nails turn yellow, thicken, and grow slowly, you might have yellow nail syndrome. This rare condition is associated with lymphatic system dysfunction, chronic respiratory disease, and sometimes cancer. The lymphatic system drains fluid from tissues. When it fails, fluid backs up, causing the nails to swell and discolor. Yellow nails can also indicate fungal infection, diabetes, or liver disease causing jaundice. If your nails yellow alongside fatigue or breathing problems, get a chest X-ray and liver function tests. Shape 9. White spots and lines. Small white spots on the nails, called leukonychia, are almost always harmless. They're caused by minor trauma to the matrix. You bump your finger, the matrix gets briefly disrupted, and a white spot forms. It grows out with the nail. The myth that white spots mean calcium deficiency is false. True nutritional white spots are rare and appear as horizontal white bands, not random dots. However, if the entire nail turns white, that's different. Terry's nails, where the nail is white with a narrow pink band at the tip, can indicate liver cirrhosis, kidney failure, or congestive heart failure. Half and half nails, where the bottom half is white and the top half is pink or brown, are associated with chronic kidney disease. Shape 10. Dark streaks. A single dark vertical line under the nail is usually a benign mole in the nail matrix, especially common in people with darker skin. But a dark streak that appears suddenly, widens over time, or extends into the surrounding skin could be subungual melanoma, a dangerous form of skin cancer. Melanoma in the nail bed is rare but deadly if missed. The classic warning sign is Hutchinson's sign, where the pigment spreads from the nail onto the cuticle or finger. If you see a new dark streak, especially if it's wider than 3 millimeters, irregular in color, or only affects one nail, see a dermatologist immediately. Early detection saves lives. The bottom line: your nails are not decorative, they are diagnostic. A healthy nail is smooth, pink, and gently curved. Deviations from this template are your body's way of communicating. Spoon nails scream iron deficiency. Clubbing shouts chronic oxygen deprivation. Bow's lines document past trauma. Pitting signals autoimmune activity. Dark streaks demand melanoma screening. You now have the knowledge to read these signals. Don't ignore them. If you notice sudden changes in multiple nails, don't wait. See your doctor. Bring this information. Most primary care physicians aren't trained in advanced nail diagnostics, so you might need a dermatologist. Your nails are recording your story. Make sure you're listening.